Hello and welcome to the BadgerCare Plus and Medicaid Continuous Eligibility webinar. My name is Jenny Appleby and I'm with Covering Wisconsin in the Milwaukee Enrollment Network. I will serve as moderator for today. A couple of logistics before we get started. First, all of the attendees, if you're watching this live, you are muted. So please go ahead and if you have a question, submit it into the chat box. We'll be monitoring that throughout today. Also, if you're wondering, we are recording this session and it will be posted probably by later today on Covering Wisconsin's YouTube channel. And also the slides, you will be getting a copy of the PDF copy of the slides. And so everybody who's attending the live session today, if you registered, I have your email address. I will send you a copy of those slides after the session. If you are listening to a recorded version, you can send me an email. It's on the screen there and I can send you a copy of those slides. So for the introductions, as I said, my name is Jenny Appleby, and then why don't we go ahead and have Maciel introduce herself.
Good morning, everybody. My name is Maciel Gomez, and I'm an Enrollment and Outreach Coordinator with the Department of Health Services.
And Adam?
Yeah, my name is Adam Van Spankeren. I am the Navigator Program Manager with Covering Wisconsin.
And Kate.
Good morning. My name is Kate Schilling. I work at GWAR, Greater Wisconsin Agency on Aging Resources. We do a lot of work behind the scenes, so if you've never heard of our name, that's probably why. Thank you.
Thank you. So a lot of expertise here today for the webinar, and what you'll kind of learn as we go through, Maciel is going to start out and kind of address some of the continuous eligibility common questions that have been coming up. Adam will address things that have to do with Medicaid and Marketplace. And then Kate is really going to get more into the Medicare details. So to kind of set the scene, BadgerCare Plus and Medicaid, both of them have right now what's called continuous eligibility. So what that means, due to the COVID-19 public health emergency, last March of 2020, it was determined that anybody who applied and was found eligible for those programs was going to stay enrolled in those programs. They weren't basically kicked off of those programs for the duration of the public health emergency. So what that means is that people from back over a year ago, if they enrolled and were found eligible, they are still receiving those benefits. They are still on those programs. So with that, we're over a year now into this continuous eligibility. And a lot of people are coming to us at Covering Wisconsin Enrollment Assisters with questions about that continuous eligibility. So I really appreciate our presenters today. We've had a lot of emails and conversations, and we thought, let's compile all of this into one single place today. So with that, the format we're going to do, if you've attended some of our other trainings, is basically I'm going to ask a question and then our experts here are going to help answer and clarify. If you feel like after they answer, you still have a follow-up question, please feel free to put that in the chat box. So the first one, we're going to kind of start out with Maciel, these first few, just related to what we're going to call the public health emergency, or on the screen, you'll see it as PHE. So the first basic question is, how long will current members continue to receive BadgerCare Plus or Medicaid?
And the answer to that, everybody, is as long as the public health emergency remains. The current public health declaration is set to expire on the 21st of this month of April. However, the Biden administration has sent letters to the governors of all the states of the United States notifying them that the plan is to continue with the public health emergency at least until the end of 2021. And states should be notified at least 60 days before the end of the public health emergency so that we can prepare to go ahead and notify our members whether they have a renewal that needs to be done, whether their coverage should be terminated due to the fact that their income has changed. So proper notification is the goal, to go ahead and notify all of our members.
Thank you. So I think the quick takeaway is that it's still not going to happen for a while. As long as we are in this public health emergency, people are not going to be basically losing their benefits for BadgerCare Plus and Medicaid. But then a follow-up question. So what if somebody found to be eligible, they've had that Medicaid or that BadgerCare Plus, but that member's income increases or has increased?
Absolutely. So during the pandemic, I know that individuals were either laid off or lost their jobs because of the pandemic, and their income decreased, which would qualify them to have BadgerCare Plus. We also had members that had BadgerCare Plus as of even before March, but continued to have it throughout the duration of the pandemic. And once society started opening up due to the pandemic, the numbers being safe and whatnot, the state of Wisconsin understood that because the pandemic, the public health emergency continued, their coverage would remain open regardless of their income increases or decreases. So any changes in income for the Medicaid portion of coverage, they would not affect their coverage. They would not be closed until the end of the public health emergency. However, I am asking my partners and my members to keep a rule of thumb. A good rule of thumb is, should any life changes take place, that includes income, they should always report them to their local consortia within the 10 business days, simply because that change could not, it does not affect the Medicaid coverage at this time, but it could potentially affect any other programs that they have, whether it be childcare, whether it be food share, anything else that they are potentially eligible for. So rather than getting overpayments or ignoring them because they feel that the public health emergency continues, I would recommend to all of our CACs and our members to go ahead and let the IM agencies know of a change of income, just to make sure that they do not go into overpayments.
Okay, great. And I saw a question come in, and we'll actually get to it in just a couple slides. The question was, can they request to go off of BadgerCare if over income during the public health emergency? And we'll get to that one in just a moment. Okay, so the next one. Is there anyone whose BadgerCare Plus or Medicaid coverage will end during the public health emergency?
Yes, there are 3 possibilities for individuals to go ahead and have their coverage end during the public health emergency. And that would be, number 1, if someone passes away. Number 2, if someone moves out of state and would like to start benefits in that state, we would certainly close their coverage here in the state of Wisconsin. And also, individuals can request to have their coverage terminated or end or close their case with their IM agency. They can make that request by contacting their local consortium.
Yes, and we do have a few more details about that coming up as well. Okay. So this one between Marcel and Adam, if you both kind of want to chime in about this one a bit. So this gets to that question of, my situation's changed. What about that consumer who currently has that BadgerCare Plus or Medicaid, and can they switch to a marketplace plan and receive tax credits if they want to? So for example, their current income is now higher than when they applied for BadgerCare Plus.
Absolutely. If a consumer is truly eligible for BadgerCare Plus or Medicaid, they do not qualify for the marketplace tax credits. However, if they are no longer eligible, whether it be financial or non-financial, but they will continue to go ahead and have coverage simply because we have that public health emergency extension. So again, we're not terminating cases at this particular time, but they can definitely qualify for the marketplace tax credits. And to avoid duplicate coverage, the customer should contact their local consortia or IM agency to have their BadgerCare Plus or Medicaid coverage terminated. And again, they can go ahead and contact their local consortium to go ahead and do that. If they have trouble, of course, feel free to let Jenny know, and we can certainly assist you on case-by-case situations where that might not be taking place. Adam, did you have something to share on that?
Yeah, I would just add, some language to kind of help people wrap their heads around it. So basically, when we talk about eligibility, just because somebody is on or can get on because of the public health emergency BadgerCare, once they no longer meet the requirements, even if they're on BadgerCare, they do qualify for tax credits, because they're technically ineligible. And that's what the marketplace cares about and what they're going to look at when they go to the marketplace and get APTCs. But Monsieur's totally right on kind of the switching. Definitely good rule of thumb is the 10 business days. Absolutely. You want to report changes to both, honestly. And if you decide to switch, just eliminate the one that isn't your primary, because then you won't end up with any issues at tax time. I mean, there's a lot in like ARPA, for example, that's protecting people at tax time, not having to pay back excess APTCs or penalizing anybody for dual coverage. But still, you don't want to develop bad habits and get yourself into trouble later.
Yeah, and I think the takeaway is that if they're happy with the BadgerCare Medicaid coverage, there's absolutely nothing they need to do. It's more of some of those unique cases. I know there was a email circulation going around. There was somebody who wanted to get a certain kind of cancer treatment, and where they wanted to go, they weren't accepting Medicaid. This was a different part of the state. There's unique situations like that where the person had this health reason, a reason why they wanted to have marketplace coverage over Medicaid. I think those cases are few and far between. So overwhelmingly, if someone's still receiving BadgerCare, they should stay on. It's really those unique cases where perhaps they really, for some reason, want that marketplace coverage instead. And then what I was referring to was that ARPA, that American Rescue Plan Act. There are a lot more protections for those APTCs, those advanced premium tax credits, about not paying them back and stuff like that for that dual eligibility.
Right. Thanks, Jenny. Yeah, generally speaking, if you are on BadgerCare Plus, it is almost certainly going to be more financially beneficial to your household to not have to pay extra costs for health insurance. So that is a good rule of thumb as well, although there are edge cases, as Jenny said.
Mm-hmm. Yeah. There are a couple questions that came in that I think we can go ahead and just take now. One of them was, what about non-qualifying pregnant women? So first, I think to define what non-qualifying pregnant women means, and then will they continue Medicaid eligibility after delivery, or should we notify the IM workers?
Notify the IM workers of what? Sorry.
Yeah, that's okay. So first about what would a non-qualifying pregnant woman be? That definition of that.
Non-qualified pregnant woman, I'm assuming doesn't meet the residential requirement that it needs to be met. Typically, the women are either incarcerated and they need to go ahead and have BadgerCare Plus for the duration of their pregnancy. Also non-qualifying, they just don't meet the citizen requirement for the United States, and they don't have lawfully permanent residence or something to that effect. And they should go ahead and apply for the BadgerCare Plus for the pregnancy, make sure that they are covered for their prenatal visits. It is my understanding that the system doesn't recognize that it's a different population and they're not cutting off those cases. However, don't quote me on that. This is going to be one, Jenny, that I'm going to ask that we take back on that particular case. And also, I do see that there was an email from Sharon that was asking a case specific. It sounded like someone applied and their coverage terminated, and she was asking whether or not policy should have continued that case. I typically like to take a look at cases in detail. So if Sharon can follow up with a detailed email on that particular case, and I can do some research and answer to the best of my ability on that one. But the coverage, they should go ahead and continue, get the coverage to make sure all prenatal visits are covered. And then I will follow up with Jenny to make sure whether or not the end date should be the days after, the month after the baby is born, or if it will continue during the public health emergency.
Mm-hmm.
Right. And I think for that second one, we're talking about regular BadgerCare Plus, it should, in my mind, follow the rules attached to the public health emergency. Monsieur's, you're going to look that up and make sure we're not wrong on that. But the first question, I think, is possibly referring to the BadgerCare Plus prenatal program specifically. Monsieur's, what you were, I think, referring to.
Mm-hmm.
I don't know that in the system, if that is a code that would be recognized as full BadgerCare Plus. Does that make sense?
Mm-hmm.
Yeah, definitely. And that's why it's one of those where I'm not sure if the system understands that that one is not the same as regular BadgerCare Plus or Medicaid, and it would shut off after the duration of the pregnancy, or if it would continue simply because of the public health emergency. I have heard mixed messages, and I definitely want to look into that, being that we're trying to share the best information available to these folks on this webinar.
Yeah, those are great questions, honestly.
Mhm.
Yeah. Thank you. And I think one of the themes throughout this will be that sometimes these unique individual cases just need a little more exploration. And so at the very last slide, I will have my contact information. Not that I'm going to know all the answers, but I can help triage and get you to the right person, whether that be a MASIL or your local, as Kate will talk about, your ADRC near the end. So thank you. So keep the questions coming. This is always helpful to kind of troubleshoot some of this. Okay, so Masael, another question for you. Why are some consumers reporting that they have received a BadgerCare Plus or Medicaid closure letter, or their consortia, they were on the phone and their consortia said their case was closed?
The reason for that is that we have two particular systems that may not have been communicating effectively regarding the extensions that were granted because of the public health emergency. The IM agency works in the particular, in a system called CARES, and the CARES system would go ahead and follow all of the regular BadgerCare Plus policies, whether or not an individual would be closing on a case, or if someone was moving out of state, they would go ahead and close that case and such. But there are some families that, and some individuals that were receiving letters notifying them that their case was closed. However, the state of Wisconsin cannot close those cases due to the public health emergency. So what's been done is their extension has been granted in the Forward Health portal. And the Forward Health portal is the tool that our providers and our community partners use to go ahead and verify eligibility. So there were some instances where individuals were receiving a letter stating that their case was closed. And then I would say either days or a couple weeks later, excuse me, there was a letter notifying them that they would go ahead and have their eligibility continue because of the public health emergency. I do understand and I do appreciate some of the confusion that took place with that. However, clarification is only a phone call away. You can certainly call the back of the Forward Health card to verify whether or not eligibility has continued. However, please note that they are only closing cases and keeping those cases closed if they meet the three exceptions: whether the individual passed away, whether the individual moved out of state, whether the individual specifically requested to have their case closed. So please note that if it met those three conditions, then their case is closed. But if they have questions, feel free to contact their local IM agency. And if not, contact the Forward Health member services line and they'll let you know whether their eligibility was granted.
Asiel, can I ask an example question related to that? Because I'm trying to figure out what the consumer experience is. So say they get this closure letter and so they're thinking, oh, my case is closed, or maybe they haven't opened it yet. If they were to go to fill a prescription or pick one up or to an appointment, would they have any trouble, or would the provider more than likely still find them in the Forward Health portal? Does that make sense?
The last two part of the question seemed like the same question. So I believe that an individual, even if they had a closure letter, they left it on their kitchen table, they never opened it, and they went business as usual to fill their heart medication or whatever it was that they needed, they should go ahead and continue to do that, because what the pharmacy will do, they will take a look at their system, which is tied to the Forward Health portal, and it would show the eligibility has continued. I don't believe that they would have trouble because the eligibility is still there, regardless of what that letter stated, because of the extension, unless they met those three criteria.
Right.
So I just want to be clear. Yeah, I wanted to be clear that unless they met those three criteria, then the Forward Health portal should show an end date on their span of coverage.
Right.
Thank you.
Thanks.
One of the main takeaways of this one is that overwhelmingly, the local consortia information that they have on file matches the Forward Health portal. There are some of these exceptions where, for whatever reason, at the consortia level, a letter was automatically generated or it shows closed. But truly, as the italics at the bottom says, is that even if the local consortia shows the case was closed, remember, all of it has been extended on that Forward Health portal. So even going back to one of the questions in the chat, was, I have a patient that was eligible and her coverage started at August and then was ended at the end of October. Should it have ended? Perhaps, I don't want to speculate for sure, but perhaps that's one of the cases where the coverage in Forward Health truly didn't end. It may not be, but it sounds like if someone is unsure, the member services, the BadgerCare Plus member services number is where you can call for that clarification on whether you are active in the Forward Health portal.
Yes, the Forward Health portal will have all the nitty gritty simply because the IM agency can see in their system, which is CARES, and that is the management of the case, but the coverage spans are all housed in the Forward Health portal.
Great. And then another question that came through, what about if someone was on BadgerCare and is now married and eligible for insurance through their spouse? Should they go on the spouse's insurance?
They definitely have the option to do that. I actually had a case recently where a woman married her husband and wanted to add herself to her husband's case and was able to go ahead, contact the consortium and let them know that she would like that case to be closed, and so that she can go ahead and continue to have coverage through her husband's insurance plan.
Mm-hmm. So I think, again, this is a situation of if that's what that person wants, but they could remain on the BadgerCare. And also remember, when people eventually, if they're no longer eligible for BadgerCare based on financial or non-financial requirements, when they get to that point, and we'll talk about that in a slide or two, that oftentimes that loss of coverage would trigger them being able to add marketplace coverage or something else, because that would give them that special enrollment. A lot of employer sponsored insurance plans too, when you have that loss of coverage, triggers you to be able to special enroll outside of open enrollment.
Mm-hmm.
Okay. So how will consumers know when the public health emergency is over and they are up for renewal or their healthcare coverage will end?
So definitely by law, the state of Wisconsin needs to send mailings to our members, notifying them of any change that takes place within their case. So we will be sending mailings as soon as we're able to the members. However, we realize that the CACs and the community partners that are on this webinar are an extension of the department and can provide great messaging to our members because you're on the ground speaking with the members on a daily basis. And we will continue to go ahead and host our stakeholder calls, which take place every other Wednesday. And we will also continue to send Forward Health partner emails notifying them of any type of change that's taking place or any updates that are taking place regarding the public health emergency.
Thank you. And if you have not been attending any of those stakeholder calls, I just put in the chat, it has archived calls, what the topics were those days, and also at the bottom you can sign up for the email list, and so you'll get those reminders about the stakeholder calls.
And I should mention that we don't anticipate any changes to take place until 2022, being that the Biden administration has encouraged states to letting states know that they will go ahead and remain until the end of the year, which is December 31st, 2021. That would mean that we would have to send mailings out to our membership to go ahead and let them know of a change in their case. And we would legally have to have 45 days notice for that. So it wouldn't be until the beginnings of 2022.
Great. And then it also says that not all consumers will be up for renewal at the same time.
Yes, absolutely. The goal would not be to go ahead and have to address what the state has been calling the bubble all at once. We definitely would stagger the renewals and such. And it's my understanding that the plan would be to go ahead and start with those who would probably have a renewal take place in March of 2020 and then go from there. So we would go ahead and just start picking up the work from where it stopped.
Thank you. Okay. So now we're going to get into that 65 age, that Medicare age. So turning 65. If a consumer currently has BadgerCare Plus and turns 65, will they continue to have BadgerCare Plus?
So I don't know if I should take this one, Kate, or if you wanted to, but I think I'll start if that's okay with you. Wonderful. So those individuals who actually age out of the BadgerCare Plus program and are turning 65, the general rule of practice is the IM agency will go ahead and test that individual for the different programs that might be available to them, so that they can go ahead and ensure that they're in the best available medical coverage program that they're allotted to because of their income. And should they go ahead and need to apply for other benefits, they would be notified with a letter. So that is my understanding, that the IM agencies would go ahead and test those cases to see whether or not they would qualify for the Medicare savings program, or whether or not they would qualify for any elderly, blind, or disabled benefits that would be available to them. Kate, would you like to add to that? Okay, so that is the understanding, that they should go ahead and be tested for that by the IM agency. However, what I do want to let CACs know, and also any partners that are on the line, if a consumer is curious and wants to know what needs to happen, don't hesitate to pick up the line and call your local IM agency and find out what the status is on their case, or what actions that they may need to take in order to verify, in order to ensure that they have coverage. But just know that their coverage under BadgerCare Plus would remain if they would qualify for a benefit that's lesser than the full benefit program of BadgerCare Plus through the duration of the public health benefit. Public health emergency. So if I'm an individual and I am 64 years old, I am aging out to be 65 next month, and my IM agency tests me and notices that I would be deemed eligible for a program that would be lesser than the full BadgerCare Plus benefit, the state would have me stay with BadgerCare Plus until the end of the public health emergency. However, I have my own choices to make. So I would go ahead and be tested for, and I would be told that you tested for EBD, you also tested for Medicare savings program, your coverage would be lesser than. Then I can go ahead and make my own decision as to what it is that I would like to do, whether it be with the Medicare Part A and B, and things of that nature, which I'm sure Kate will go ahead and discuss. But just know, rule of thumb is, if I am 65 and I am deemed eligible for a benefit that's lesser than BadgerCare Plus through the duration of the public health emergency, I will remain on BadgerCare Plus until that is lifted.
Thank you. So again, with this, that they didn't fall into one of those three exceptions. They didn't pass away, move out of state, or request their case closed. And so that's why they would not be ending. Okay. So kind of an important piece though, right? Kate, what should a consumer who has BadgerCare Plus or Medicaid and turns 65 or gains that Medicare entitlement, and maybe you can speak to what that is, do in terms of Medicare? So just because they'll still have that BadgerCare coverage doesn't mean necessarily they shouldn't do anything for Medicare.
Which is a great point. Thank you for bringing that up. I appreciate that. Yes, so a person's going to become eligible for Medicare either when they turn 65, or if they've been on SSDI, which is Social Security Disability Benefits, for 24 months. Which is actually 29 months after they've been determined disabled. There's a 5-month waiting period. So 2 years after their SSDI benefits start, or 3 months after they've had end-stage renal disease and after they've had dialysis to take care of, to help the end-stage renal disease, or after they've had a transplant for end-stage renal disease. So most people become eligible for Medicare by definition by turning 65, but of course, having other disabilities, people can get it as well at a younger age. But for the most part here, I'm going to talk about the folks who are turning 65. So when they turn 65, they have what we call an IEP, and we have a lot of acronyms in elder law. Everything's an acronym. So IEP stands for Initial Enrollment Period. It's the 3 months before you turn 65, the month you turn 65, and the 3 months after you turn 65. So it's a 7-month window where someone can enroll in Medicare. And the soonest it will start is the first of the month of their birthday month. There is an exception if you're a first of the month person, then it can actually start a month earlier, but that's the exception, not the rule. So it starts the month of your birthday, or if you enroll later, there will be a delayed start date. So for example, if you enroll 3 months after your 65th birthday, which is the last month of your initial enrollment period, then it starts 3 months after that. So it actually is delayed by 6 months. So depending on the month during your IEP that you enroll, that determines when Medicare starts. So if you enroll the 3 months prior to your birthday, Medicare starts the month of your birthday. If you enroll the month of your birthday, Medicare starts the next month. If you enroll the month after your birthday, Medicare starts 2 months later. If you enroll the second or third month after your birthday, Medicare starts 3 months after that. So there's a window, but this is called your IEP. Now, most people need to enroll in Medicare during their IEP. And if they don't, there are consequences. Now, the one time someone would not need to enroll in Medicare during an IEP is if they're actively working, okay? So actively working means not retired and physically going to a job every day, or I guess during the pandemic, it can be working from home too. Right now, when I go to a job, it's going from my bedroom to my home office, right? So about 4 steps, but physically and actively working. Now, if someone has retirement coverage, that is not active employment. If someone has COBRA, that is not active, that is not health insurance through active employment. Likewise, Marketplace is not health insurance through active employment. It has to be that you or your spouse are actively working, or, I'm sorry, and you get the health insurance through that active employment. And you cannot have end-stage renal disease. If you do, then your situation is very complicated, and we look at those one-on-one. But people with end-stage renal disease, when they turn 65, should not delay Medicare because they don't get the option to pick it up later down the road. So that's a problem. So generally speaking, we tell everyone you need to enroll when you turn 65, unless you or your spouse are actively working and you get the health insurance through active employment. And again, we see a lot of folks who are, I'm going to pick on teachers for a minute because I know they're working really hard right now. Teachers are state employees, or I'm sorry, they have state retirement benefits, I want to say, not necessarily state employees, but they have state retirement benefits. And so they can usually convert their sick leave, into paid retirement health care. But if they've already retired, that's not active employment through health, that's not health insurance through active employment if they're retired. So that becomes a sticky issue. And those people, even if they've already retired, we encourage them to take Medicare at age 65. So there's a lot to think about. There's a lot going on here. Now people say, well, if I have Medicaid, why would I need to take Medicare? We're going to talk about that on the next couple slides, but Medicaid is not health insurance through active employment. So there's only one way or one reason to turn down Medicare at age 65, and Medicaid technically doesn't count as that. So a lot of people think that they'll be okay, but we're gonna talk in the next few slides. There would be problems if you didn't take Medicare when you turn 65. You'll have gaps in your health insurance. You won't be able to get in when you want to. You'll pay a late enrollment penalty for the rest of your life, and you could have coverage issues. So there are some big problems there. So generally speaking, though, everyone needs to enroll at 65 or have health insurance through active employment. Now, if someone's actively working, there are some additional rules there. So I've said they need to see a benefit specialist, because one of the rules is, does the employer have fewer than 20 employees? If so, then you still have to take Medicare at age 65, and your health insurance from active employment doesn't matter because Medicare will actually pay primary to your health insurance through your employer. So it's a sticky situation. We encourage people to get one-on-one counseling through the Aging and Disability Resource Centers in the state. But even there are exceptions to the exceptions. So it's always recommended that when people turn 65, they talk to people at the Adrc about coordination of benefits issues, enrollment issues, and also are they, what are their options? Are they eligible for Medicare savings programs like Maciel discussed in the last slide?
Thank you. Thank you. And so one clarifier, which we think you mentioned, you answered, but just the early question came in, is just that I presume the details in the example of the person turning 65 and becoming Medicare eligible also applies to folks under 65 who are disabled and become Medicare eligible, correct? So that would be that gains Medicare entitlement.
Yes. Yep.
So except for like that one situation of like end stage
renal disease is always a little bit more complicated. So we always recommend people review that situation. And technically with end stage renal disease, yeah, it's just different. So talk to someone one-on-one, either talk to a benefit specialist at the ADRC or talk to the Medigap helpline, because we want to counsel those people one-on-one. It's so important that we get that right, and it's so complicated. And one little fact changes the whole analysis.
Thank you. So let's talk about the importance of enrolling in Medicare when you're eligible. So what happens if a person does not enroll in Medicare during their IEP or their initial enrollment period?
Yeah, so here are the 3 potential issues a person could run into. Number 1, if they don't enroll when they should, they're going to pay a late enrollment penalty for the rest of their life, or the rest of the time they have Medicare throughout the rest of their life. So it's 10% per year enrollment penalty. So 10% per year they were not enrolled in Medicare, but they should have been. So for example, this week I had a client who was a 75-year-old gentleman, and he had VA coverage. So he was a veteran, and he was receiving free coverage through the Veterans Hospital, which was a little over an hour away. And so he was doing okay, and he didn't want to have to pay for Medicare Part B premiums. So he had only enrolled in Medicare Part A, which is generally free to most people, and he had declined Medicare Part B. He was not actively working. He just declined it because he didn't want to pay premiums. And he said, I'm getting health insurance through the VA, and that's working out great for me. But sadly, what happened is that he got very sick, and he could no longer travel in his vehicle an hour to get to the Veterans Hospital. So he called us this week, and he said, I want to add Medicare Part B. And he had gone without Medicare Part B for 10 years. So at 10% penalty per year, he's paying double the Medicare premium. So the Medicare Part B premium right now is $148.50 a month, so about $150. He's going to pay, once we get him enrolled in Medicare, which is the bullet number 2, once we get him enrolled, he'll pay $300 a month for Medicare Part B for the rest of his life, or the rest of the time he has Medicare, because there's a penalty for late enrollment. He should have started his Medicare when he turned 65. Now, if someone was on SSDI, so if they had been like, let's say 35 when they became eligible for Medicare, one little piece of trivia is that the penalties start over when you turn 65. But this gentleman wasn't on SSDI. So the penalties reset when you turn 65, they go back to 0. But he only was eligible when he turned 65, as are most people. So he's going to have this penalty for the rest of his life. And he will pay, once we get him on Medicare, he'll pay $300 for Part B for the rest of his life. The problem is that he's come to us and said he's very sick, and now he has cancer, and he needs chemotherapy and other treatments and medications. And he has fibromyalgia, and so driving in the car for over an hour is not something he can physically do. His health is too frail to be able to do that. And veterans benefits don't coordinate with Medicare, because if you have veterans coverage, they'll treat you at a veterans facility, but they don't really pay anything if you go to a non-VA facility. And so he has Medicare Part A, which is hospital coverage or skilled nursing facility coverage, but he doesn't have any outpatient coverage for Medicare. And a lot of the chemotherapy and things that he needs to do right now are Part B, which is your outpatient coverage. So everything that's not inpatient. So going to the doctor, getting rehab, getting lab work done, any of that, it's all covered under Part B, which he declined to take because he was healthy at 65. So Medicare is like other insurance products, and it's a risk pool, right? You need healthy people paying into the insurance to balance out the sick people who are filing a lot of claims. And Medicare has the same general principle. They need healthy people to pay in. So that's why they do require you to take it at age 65, unless you have coverage through active employment. You have to take it even if you're healthy, right? So they want you to take it at age 65. And if you don't, you will be penalized. So let's go to number 2 here. The problem for this gentleman, he came to see us on April 5th. Okay, so April 5th was this week, and he was a week short of the deadline to sign up for Medicare Part B. So for the people who don't sign up during their initial enrollment period or their IEP when they turn 65 or are somehow otherwise eligible, there's a period every single year from January 1 to March 31st called the General Enrollment Period, or GEP, where if you didn't sign up for Medicare Part A or B and you were supposed to, you can enroll during the General Enrollment Period. You're going to have a penalty, and your coverage isn't going to start until July of that coming year. So had he come to see us, or Social Security is where you sign up actually, but we would have helped him with that. Had he come to see Social Security on March 30th or 31st, or you can go online and sign up, right? He would have been okay. And he would have done the Medicare Part B enrollment, and it would start July 1, 2021. Okay, so just in like 4 months or so. The problem is he missed the March 31st deadline. He came and asked questions starting on April 5th. That was our first contact with him. So our advice to him is, well, next year, January 2022, you can sign up for Medicare Part B then, and your Medicare Part B will start July 2022. So he has to wait 16 months to get his Medicare Part B to start. So that is why we tell people you have to sign up at age 65. Now I'm going to tie this back into BadgerCare, because I know I'm not giving a Medicare 101 here, but BadgerCare and Medicaid are what we're talking about here. As you heard from Maciel this morning, BadgerCare and Medicaid are expected to continue through the end of the year during the federal public health emergency. But then starting probably in January, notices are going to go out to clients. We're expecting that clients will be disenrolled from Medicaid and BadgerCare in February, right? So if someone had not taken their Medicare when they should have in an earlier initial enrollment period, during February, they can sign up under the general enrollment period, and then their health insurance will start in July 2022 if they wanted Medicare Part B. They're going to have a penalty, and they'll probably have 4 months without any health insurance coverage whatsoever, because we're anticipating the BadgerCare would go through February, maybe March at the latest. So people will go without health insurance, and there's nothing that we can do about that. I've been advocating for older adults for 12 years, and those are the rules, and there's no way around that. So if you don't enroll when you should, you're going to have not only a late enrollment penalty, sometimes that's the least of your issues. You're not going to be able to sign up when you want it. The veteran who came to us this week said, no, I need health insurance now. I don't think you understand. And we said, I'm sorry, but those are the rules associated with Medicare. You turned down Medicare Part B when you should have enrolled. And unfortunately, you're a week late for the general enrollment period. So when January comes, go to your local Social Security office, sign up for Part B, and it will start July 2022. And unfortunately, we have nothing to offer him in terms of other health insurance options right now, because he is eligible for Medicare. He's eligible for free Medicare Part A, and he's enrolled in free Medicare Part A. That means he doesn't qualify for premium tax credits on the marketplace. And technically, since he already has Medicare, he shouldn't be on the marketplace. He could get a private insurance plan that's not through the marketplace, but to be real honest, a lot of those have a lot of pre-existing health insurance conditions, and I wouldn't recommend that for a person with cancer, right? So he is in a real quandary here. He can't get Medicare, and he cannot, and he needs health insurance now. So we always say, you know, you can't wait to buy health insurance till you're sick. And it's the same thing with driving a car, right? You can't wait to buy your car insurance till after you've had a car accident. You need to buy it in advance so that you have it in place when and if something comes up later. So my risk or my warning to folks who, even if they have BadgerCare or Medicaid and they say, I don't need to sign up right now because I have this other health insurance, Medicaid is great coverage, but you need to still enroll in your Medicare. And that brings me to my third bullet is Medicare will always be primary to Medicaid, whether it's BadgerCare or Medicaid, like elder, blind, and disabled Medicaid. And under federal law, Medicaid has the right to not pay for something if the person was eligible for Medicare and Medicare would have covered it or paid primary on it. And I actually have seen this happen. So people say, well, it's the same different, or, you know, it doesn't make a difference to the client. It's the same outcome to the client. They have very little copays. It's the same as if they were just on Medicaid, but it's not. First of all, Medicaid is a 60-40 combination of state and federal dollars, right? So we can spread our money, our state money goes further if Medicare, which is 100% federally funded, if Medicare pays primary and then Medicaid is only picking up secondary, our money goes further. And that's really important. I have a 9-year-old son who's in a wheelchair. He's a quadriplegic, he has seizures. He's on health insurance through our active employment, my husband's and mine, but he also is on Medicaid, and we depend on that Medicaid. And we need the Medicaid to pay secondary on things that other insurance won't pick up on. So there are a lot of people, just like my son, who need the Medicaid secondary as well, and we need it to go as far as it can. So even if it doesn't make a difference ultimately to the client, it does make a difference in terms of where the dollars and cents are coming from and spreading our state money as far as we can, but also it protects the client. So one example is Medicare. If someone's on Medicare, Medicaid will not pay for any medications unless the person has a Medicare Part D plan in place. So even if they're dual eligible, a lot of people say, oh, don't worry, my Medicaid will pick it up. Nope, your Medicaid won't. Medicaid will only pay secondary to a Medicare Part D plan. So if they're eligible for Medicare, they have to have that Part D in place or they're not going to have drug coverage. So that will be a huge issue for people. Now, usually they're auto-enrolled into a drug plan if they're a dual eligible Medicare, Medicaid, but that doesn't always happen. I've had some of those. Actually, I had one this week where that didn't happen. So they need to be proactive and they need to be enrolled in Medicare. So are there questions about that? Maybe I'll pause for a minute. I've done a lot of talking here.
No, that was really, really important information, because I think the main takeaway is, yes, even if somebody is technically still covered because of the public health emergency, they do still need to act when they reach that Medicare eligibility. And that's really important because I can see how people think, I'm fine, I have coverage, but not knowing these implications. So a couple of things came in. Can you please provide information so that we can inform members and help avoid their penalty costs? Is there any sort of handout or info, or how could we best share basically this slide with our consumers to say, you know, I'll send out a copy of the slide, but what
Right.
can we give consumers who are turning 65
Yep.
and feel like, no, I'm good, I have BadgerCare right now that they still need to act. Is there anything you've seen like that?
The best thing to do would be to just Google Medicare and late enrollment penalty. The Medicare.gov website has a lot of great information, and it's directed towards consumers, and it's pretty clear about that. So it's pretty clear about 10% per year Part B penalty if you don't enroll when you should. Unfortunately, I don't have any specific brochures on it. The local ADRC, maybe just double check with them and see if they do. But Medicare itself, Medicare.gov, not Medicare.com, because that's a private insurance company actually. But Medicare.gov has some great information, and sometimes it's not in publication format, but it's just a couple pages, and I print it out and I give that to consumers.
Okay. And I'm kind of taking notes as well, because, you know, at Covering Wisconsin, we have lots of easy, simple to understand health insurance literacy materials. So I can't promise that we're going to crank something out, but it's definitely something I'll bring back to the team.
Mhm.
There are things that was just a comment that came through from one of our veteran insurance agents attending the webinar, is just that talk about for that veteran, let's say for his case, is that he doesn't know of a non-marketplace private insurance that would cover a 65 plus individual, especially in the case where, you know, some of these health concerns. So that's where the importance is that in that age category, when they become Medicare eligible, it really can't be wait until you get sick to try to find coverage, because the answer, unfortunately, like for this gentleman, is probably until he's Medicare eligible. Can he somehow get to the VA until that time, because it looks like he's probably not going to be eligible for anything else.
Great point. Thank you. Yes. Mm-hmm.
Okay. And then there was a question, but I'm going to wait until after the Medicare section because it's more general.
Okay.
We'll go that. And then would you mind sharing this example of that person? I mean, you had a real life example, but this example of just when somebody did not enroll in Medicare during their initial enrollment period.
Yeah. So yeah, this is my example that it's again a person who has to wait 16 months. So my agency dreads the first week of April, because we've had 3 people so far this week come in and say they needed Part B. And this was the first week that they brought it up or thought of it or sought help. And actually, I should clarify, my agency works behind the scenes. So GWAR is Greater Wisconsin Agency on Aging Resources. And there are 4 of us attorneys who work behind the scenes. So cases come in through the county ADRC, Aging and Disability Resource Center. And if there's a problem or something that needs legal research or something that needs to be appealed, then it gets escalated up to my office. So all the cases have to come in through the ADRC. We don't take consumers, we don't take consumer questions in general, because there are only technically 3.5 of us full-time employees working in the program. So we can't work that way. We require people to go to their county ADRC and get the help and questions and benefits counseling there. And if there are problems, then it gets escalated to my office. So we've had 3 people so far this week, though, where it was escalated to my office to say, is there anything you can do, Kate, to get this person into Medicare for July 1st? And sadly, my answer is no, there's not. If Social Security gave them wrong information and told them you don't need Part B, or Social Security misinformed them about when they could get in, that's the only time I can request an equitable relief, but it has to be bad information from a federal employee, so Social Security. Or if someone at 1-800 Medicare misinformed them, I might be able to, but that's a little bit harder, because Social Security actually is in charge of the enrollments for Medicare Part A and B, hospital insurance, and the outpatient insurance. Medicare does the enrollments for Advantage plans and Part D plans, so which are drug coverage. So let's go back to my example. So this is a gentleman, again, I just called him Joe. He turned 65 last year in June, and he may have had BadgerCare Plus or Medicaid at that time. And for whatever reason, he declined, or he might have been okay. He might have been fully healthy and again, declined Medicare during his enrollment period. Now, he has a choice to do that, but there are consequences to that choice. So he turned down his Medicare Part either A or B during his initial enrollment period, which was last June. And now he comes to us in April 2021, this month. And he says, now I want my Medicare Part B. And technically, if he has premium-free Part A, the hospital insurance, and he doesn't have to pay that monthly premium, he can get in at any time. It's only if you don't qualify for premium-free Part A that Part A is the problem. You can usually get in any time if you have premium-free, which 99% of the people on Medicare have premium-free Part A, because you've paid into that your whole life through your FICA taxes. So Part A is not usually the issue. It's Part B, because Part B is the one you pay for. So let's say Joe turned it down during his initial enrollment period. Now he comes to us in April, he's sick and he needs to get that Part B now. Unfortunately, he's a week too late to sign up under the general enrollment period. I know his IEP is already lapsed because he turned 65 last June. So those 7 months around his birthday have already lapsed. And I say, Joe, were you or your spouse actively employed for any part of the year since your IEP in June? And if he says no, then he has to enroll through Medicare through the general enrollment period. That's the only way he can get in. And so if he's late, then I tell him you need to enroll next year during the general enrollment period, which will be January through March 2022. And then your Medicare Part B will start July 1, 2022. So he's going to have to go a full 16 months without Medicare Part B. So he's not only going to be the restrictive enrollment penalty or restrictive enrollment time, he can't get in when he wants to. He has to pay at least 10% higher penalty for the rest of his life. And he's not going to have health insurance right now when he needs it, right? So that's a big problem. And I want to say there is one. So remember when I said there's nothing I can do about getting someone in other than the general enrollment period? There are two exceptions to that. One is if Social Security misinformed the person, gave them bad information saying you don't need Medicare, we can request an equitable relief review, but it's not always granted. Number two, the other situation is something Maciel brought up earlier, which is if they qualify for a subsidy under Medicare, and that subsidy is called the Medicare Savings Programs, QIMBY, SLIMBY, or SLIMBY Plus. And those are subsidies that pay their Medicare Part B premium, the $150 a month, and QIMBY, which is for people who are under 100% of the FPL or lower, actually will pay their Part A premium, their Part B premium, and their co-pays and co-insurance for Medicare, the 20% and their deductibles. So that is one way. They have to be under 135% FPL to qualify for QIMBY, SLIMBY, or SLIMBY Plus. Under 135% FPL, I'm sorry. And they have to have assets under, let's see, 7,000, I think, for, I've got it here, 7,970 if they're a single person, and just under 12,000 if they're a married couple. So if they qualify for the subsidy program, I can get them in to Medicare Part B almost instantly, regardless of whatever time of year it is. But they'd have to qualify for the subsidy program. Now there is another subsidy, it's called QDWI. I've never in 12 years had a client actually qualify for that one. So I've just had the QIMBY, SLIMBY, and SLIMBY Plus. So that's a one way I can get someone in. So whenever someone comes, you know, April 1st, the week of April 1st, we always say, there's nothing I can do unless Social Security misinformed them, or are they going to qualify for a Medicare Savings Program subsidy? The subsidy, again, pays for their Part B premium. And if it's the QIMBY subsidy, it pays for Part B and Part A premiums and the co-insurance and 20% in deductibles. So those are my only options. Now, if it's someone who has income above $1,500 a month, then they don't qualify for that. So those are needs-based benefits. Those are income and asset restricted benefits. So yeah, so I just wanted to mention that because that was brought up earlier.
Yeah, thank you. And I know we're coming up on time. I have about 5 questions. I think 3 are for you and 2 for Maciel. But before I get to those, could you just let us know, because I know for a lot of us, the Medicare part is not something we're as familiar with. So if we have those questions, whether we have the questions or the consumer has the questions, where should we refer people to? Because unlike where Marcel, I know, has been very gracious in working with examples of cases, we can't just send our cases to Kate. That's not part of her role to just send all of our consumers your way. So where can we get this kind of help?
Thank you for asking. Yeah, so the county ADRCs, now Aging and Disability Resource Centers, every single county has one. Some counties have multiple county ADRCs. In Milwaukee, I know that the ADRC is a little bit set up like the aging unit is separate from the Disability Resource Center. So sometimes the aging unit is separate and sometimes it's together. In all but about 12 counties in the state, it's all combined into one, integrated as we call it, but sometimes it's not. So basically that is the place to go to for help. My agency, as well as Disability Rights Wisconsin and some other agencies, we do bi-monthly training for these individuals. And they go through extensive amounts of training to understand all these complexities about coordination of benefits and enrollment questions and appealing denials, right? So they are your problem solvers. They will help someone with, we call it a turning 65. They do a lot of outreach about that, and they'll talk to you about whether you can delay your Medicare or not. For example, I always tell people to take Medicare Part A because it's free. So take it when you turn 65. Well, there's one situation in life where you shouldn't, and that's if you have employer coverage and they have an HSA, health savings account. That's a problem. So there are certain things like that that we need to know, and we need to ask the client on a one-on-one basis. And so people should go to the county ADRC or the Medigap helpline, which works with supplements, advantage plans, Medicare, and they know Medicaid, they know end-stage renal disease really well. So these are all situations where someone wants that one-on-one consultation, and no one is trying to sell anyone anything. We are not, it's all neutral, unbiased information. So that's what we really pride ourselves on.
Thank you. So I'm going to get to a few of the questions that had. So the first one, so for clarification, you mentioned that Medicaid can choose not to pay for prescription if a member has Medicare, but does not have Medicare Part D, correct?
Yep, absolutely correct. Yep.
Okay, thank you.
They have to have Part D, otherwise Medicaid will not cover any prescriptions. Actually, I take that back. It will cover prescriptions that Part D will never cover or is statutorily excluded from covering, but those are rare and few and far between.
And I think one of the main takeaways I'm finding too with this is that all these cases are so unique. And so that's where really working with the expert as that person ages into Medicare age is really helpful.
Yeah.
The next one, is there a Part D application online with Medicare.gov that can be downloaded, printed for consumers rather than receive multiple calls from agents when they go online for inquiry? This process causes consumers a lot of frustration.
No, there's not a Part D application aside from the plan finder, which is online at Medicare.gov. So if they don't want to do it on the computer themselves, they can call the Medigap helpline. They have a Part D help line there too. So they can call there and they'll do it with them over the phone. And they will talk them through what their top 2 or 3 best options would be. So they can do it all over the phone for someone. But they won't, or they can call 1-800-Medicare actually and get it all over the phone, but there isn't a printout of how to do Medicare Part D. And that's because it really depends on what pharmacy you use, your zip code, and what your medications are. And it's so variable. So it actually spits out results for you. Here are the top best plans for you based on the medications you take. So because it's doing all of that, behind the scenes computer work, and it's generating results based on your input, it can't really be done on paper. Now, you could ask someone to fill out on paper what their name, their preferred pharmacies are, what medications they take. You could do that. And, if you are, say, an insurance agent, you could help them pick a Part D plan based on that, or if you're, a consumer friend or something. So, but that's what you need to know is you're going to need to know their Medicare number too, but the pharmacies they go to, the medications they take, and if they are doing an Advantage plan with Part D or just a Part D plan by itself.
Thank you. And I think that this is a common thing with so much being virtual right now and people feeling like I get scam calls. I mean, how many calls a day do we get from telemarketers and ones that say spam risk? And it's like, what do you trust? So it sounds like if you have a consumer that is not sure if it's a legitimate call, that this Medigap helpline, if that's a way for them to actively call someone as opposed to the calls coming their way. Okay.
Yeah. And a lot of the ADRCs around the state are not meeting in person with clients right now just because of the pandemic. And so I do encourage people to call, reach out, make an appointment either by phone or video or however it might be. Some are doing in person, but they have, appropriate screening in place. So that varies a lot by county.
And we did put into the chat the Find an Aging and Disability Resource Center link. And so a lot of people feel comfortable that is a DHS.wisconsin.gov website.
Perfect. Thank you.
So one more question for you, Kate. Medicare member with Part A only coverage can still enroll in Part D at special times or Wisconsin Senior Care for prescription coverage as needed if age 65.
Absolutely correct. Yes. So all you need to enroll in Part D is either A or B enrollment for Medicare. You don't necessarily need both. So even if you just had Medicare Part A, the free hospital insurance are usually free, you can enroll in Part D. But just like was said here, there are specific enrollment periods for Part D, and that's every year in the fall, October 15th through December 7th. And so that's when you enroll in Part D if you didn't do it during your IEP. And senior care is a wonderful option either as an alternative to Medicare Part D or in addition to it. The one rule is if you're on Medicaid in Wisconsin, you don't qualify for senior care. You have to not be on a full benefit Medicaid program. You can have both senior care and Part D, or you can have one or the other. And senior care is really great. It's pretty easy to use. It works at a lot of pharmacies in Wisconsin. You just want to make sure whatever medications the person takes are on the senior care formulary. And that formulary is available online. It's on the DHS website.
Thank you. There was one more. When can you sign up for an Advantage plan? Only during initial enrollment or general enrollment?
Great question. You can sign up during for an Advantage plan during your initial enrollment period, those 7 months around your birthday, or Advantage plans are different from Medicare supplements. Advantage plans, you need to reevaluate every single year because the premium can change, the Medicare, or the coverage can change, the networks can change. So Advantage plans are open for open enrollment in the fall every single year. And that's October 15th through December 7th. And the enrollment change takes effect on January 1. So every single year, if you're in enrollment or if you're enrolled in an Advantage plan, you do have to review your plan to make sure it still has the coverage you want, the premium price you want, the network you want. Your doctor may go out of network mid-year or something. So you need to make sure that you still want that plan because things can change every year. And I'll contrast that to a supplement where Medicare supplements, generally speaking, someone would enroll during their IEP in a supplement, and you usually don't change that because there is underwriting for that. So usually you enroll at age 65 and you keep the same supplement usually for life with a few exceptions, but Advantage plans must be reviewed every single year no matter what.
And another question, are there penalties for late enrollment in Medicare Part D?
Yes, it's a lesser penalty than Part B. It's 1% higher penalty per month you were not enrolled in either Medicare Part D or other creditable drug coverage. So the penalty is different for Part D, very different, not only how you calculate it, but whether you get a penalty or not. The test for Medicare Part D is whether you had other creditable drug coverage. So retirement drug coverage qualifies in that situation. Senior care qualifies. A lot of things qualify as creditable drug coverage. Medicaid would qualify as creditable drug coverage, but it's not the same for Medicare Part B as in boy. So for that, is it in coverage through active employment? So it's a very different standard as to whether you get a penalty for B versus D. And yeah, the penalty for Part D, as in dog not having creditable coverage, is 1% increased penalty per month you did not have Part D. You can go 63 days without having a drug plan in place, and after that, you do get a penalty.
And I am so impressed that you've retained all this information.
12 years. I still learn something new every day, though. So, you know, I have done this every day, and every single day there's still something new to learn. So I think it's really complex. It's hard to navigate. And that's why the biggest thing I want you to take away today is where to go for help, right? So where can you send consumers? Because none of us know everything. Right after this, I have a meeting with 3 other attorneys to discuss our hardest cases, because there needs to be 4 of us to talk about some of these, because all of us put our heads together to come up with the greatest option or the best option for our clients. So every day is learning something new.
Thank you. A quick follow-up question to that late penalty for Medicare Part D enrollment, and then I think we'll get to Marciel's question. It just was, the question is that also for a lifetime?
Yes.
It is.
So
Okay.
like the Part B penalty, it will wipe clean if you started Medicare before you turned 65. All penalties wipe clean at 65 if you started earlier. But if you didn't take Part B or D at 65 or beyond, it's for the rest of your life. Unless
Okay.
you qualify for a subsidy program. Actually, the subsidy program will wipe it clean too. So a little bit of trivia there.
And actually one more Medicare question came in. Does ADRC help with Advantage plans or only the Medigap helpline?
The ADRC will discuss Advantage plans, and we will talk about, you know, maybe pros and cons. So we will talk about an Advantage plan versus a supplement. So yes, the answer is yes. They will talk about Advantage plans and supplements. And ADRCs cannot help anyone enroll in a supplement. That has to be a licensed insurance agent. But they can talk about, you know, tell me about your situation. Are you a snowbird? Well, if you're a snowbird, then maybe a supplement is better for you because there's a broader network, right? Some Advantage plans do pay out of network and some do not. Some have really tight HMO, PPO networks, and some are a little bit broader, like a private fee-for-service plan. We also have Medicare savings accounts. So we have a lot of different types. We'll talk through all of that. So we definitely will help people with what are the pros and cons of plans, and which one might be better for their particular situation. But it's always the client's choice as to what they ultimately want to do, you know, and which plans they want to enroll in or not.
Thank you. And I will say that I know at Covering Wisconsin, we are working on a Medicare how-to. It's more of a packet, but we are trying to pull out some of the concepts in such as enrollment periods, avoiding penalties, ADRC info. So keep your eyes peeled. I don't have a timeline for that, but it would come through the Covering Wisconsin listserv for that. All right, so a couple questions, kind of pivoting back a little bit more of just that general BadgerCare Medicaid continuous eligibility. So thinking back about that with Marciel, one of the questions was, if a member no longer qualified for health benefits, are they going to be subject to any penalties? So I think what this means is, you know, when they applied, their income, they met the financial and non-financial requirements, but now if they would apply today, they wouldn't be eligible. Will they be subject to any penalties?
Absolutely not. And then we're talking about the medical coverage. So we're talking about BadgerCare Plus or Medicaid. If they went ahead and were deemed eligible by the consortia and were granted eligibility, and that coverage has extended since income increased, their situation changed, which would make them no longer qualified, but continue to have coverage because of the pandemic, definitely would not be held liable because of those, because of the public health emergency extension. So that the answer is no, they should not be held liable for anything. However, it's one of the main reasons why we're keeping that good rule of thumb of reporting any type of changes within 10 business days, because it may affect other benefits that they're qualified for. But the healthcare coverage, no, they should not be penalized because of the healthcare extension.
And this was something I had a consumer on the phone too, that I was just explaining that consumers doing nothing wrong, you know, by rules of the public health emergency,
No.
have that BadgerCare Plus continuous eligibility. So even though they're working now and their incomes increase, they reported that change, they still have BadgerCare. They're not doing anything wrong. That's the way the policy is right now.
Exactly. It's what the federal government has deemed for the state of Wisconsin to go ahead and make sure that everybody who qualifies for the benefit maintains that benefit during the public health emergency to make sure that they have access to care when and if needed.
Great. And then one more question. So are there any updates to the childless adult waiver program requirements? So recall that there were some criteria added for childless adults related. This one is specific to the renewals, specifically the treatment needs question and the premium payment. So kind of what's the status of the childless adult waiver program requirements right now?
Right now, that is being suspended because of the public health emergency. And once that is lifted, we will share communication via our listserv. And we also will share communication, I'm sure, on the stakeholder call. So at this time, that is not being implemented because of the public health emergency, but stay tuned because once that is lifted, changes will come and we will notify not only the consumers and the members, but we will also be sharing that information with our partners.
Great. With that, I think that's the last one I see coming in. I'll hang on the line for a few more minutes. I just want to give a huge thank you, Masael and Kate and Adam. I know we didn't know if any marketplace stuff was going to come up, so thanks for being here as well. But I just appreciate your expertise and your availability to just be here for the participants today. With that, thank you. I'm going to go ahead and stop the recording and we'll hang on the line for just a minute.